So what does high frequency offer over a conventional ventilator? Why use it in the first place? Well, one, as we showed, there's decreased pressure transmission or volume transmission. So you can decrease volume trauma because you also get decreased peak to trough pressures in the airways. You decrease barotrauma to the airways and air leak. And then there are certain disease states that it just works better than a conventional ventilator does. And this is a slide that we did in San Antonio when we were using a baboon model of hyaline membrane disease. The slide on the left is a baboon ventilated for 24 hours with a conventional ventilator. And you notice the baby has the large open areas are conducting airways that are very distended, and the pink areas are where the saccules, as these animals were immature and didn't have alveoli, where the saccules are and where you got hyaline membrane disease. The slide on the right is an animal that was ventilated with a conventional ventilator for an hour and then put on the high frequency device. And what you note there is the lung's very uniformly inflated. There's very little hyaline membranes, and this is less injury to the lung and clearly fits with the premise that high frequency will be less injurious. Well, let's now move on to how do you actually use the ventilator for different lung diseases. Well, for diffuse alveolar disease in the preterm infant, you would start with a mean airway pressure that's 1 to 2 higher than the patient has on the conventional ventilator, and frequencies of 10 to 15 hertz are appropriate. So the smaller the baby, the higher the frequency would be reasonable to start with. And you don't want a lot of chest wall movement, so you want to see a very small amount of vibration, and then you adjust that as needed for the carbon dioxide level on the blood gas. And this is a baby with severe hyaline membrane disease. Now, this lung is so dense and so poorly inflated that this baby would probably need the mean to be 3 to 4 higher than what it was on conventional from that standpoint. With surfactant today, we get by with means in the 8 to 10 range post-surfactant. In the pre-surfactant era, that same baby would need means in the 16 to 20 range to keep the lung inflated. So surfactant certainly helps. You want to make sure you don't get the lung overinflated from that standpoint. So once you give surfactant, you have to wean that mean down very effectively. For the term and near-term infant with similar diffuse alveolar disease, again, these babies need more mean because their lung is harder to get open. We don't go above 10 hertz, and typically we use somewhere in the 7 to 10 hertz range because many of them are infected and have airway disease, and faster frequencies would air trap them. And this is a baby with severe lung disease who's a term infant, and obviously this lung is very dense and you really can't see the heart borders or the diaphragms very well. And this baby will need a fairly high mean to get the lung open. Some of these babies may need means in the 30s to get the lung open. But once recruited, that mean can be weaned fairly rapidly. High frequency is frequently used for air leak, both the oscillator and the jet and the flow interrupter. The jet has been particularly useful for PIE. Typically, we start with a mean airway pressure that's a little bit less than conventional ventilation or equal to it. Frequencies, again, rapid in the oscillator, 10 to 15 hertz in the jet, somewhere in the 6 to 10 hertz range. And you want minimal chest wall movement because you're going to accept CO2s that are a little bit higher. Again, this is a baby with fairly severe PIE that those kind of strategies should be useful on. One thing you want to be careful of is, though, the baby who is this overinflated can have compression of the airways, so there can be some partial obstruction of the airways. So if you choose a rapid frequency and the patient isn't improving, you want to think about going to a lower frequency where, because you may be air trapping because of the PIE that's present until the PIE resolves. If you have gross air leak, Typically, we would use a mean airway pressure that's equal to or one higher than conventional. Again, rapid frequencies to minimize pressure changes in the lung where the air leak has occurred. And you want minimal chest wall movement for these patients. And this is a preemie who's got a fairly normal right lung, but has a pneumothorax on the left. Again, you don't need real high mean airway pressures to keep that right lung open, and you can avoid further air leak by using pressures that are a little bit lower. For the term and near-term infant, if they have severe air leak and they have poor inflation, then you have to go up on the mean airway pressure to get the lung inflated. And again, never above 10 hertz, and typically we would use 6 to 10 hertz for these kind of patients because the most common cause other than meconium for air leak is infection in these patients. And here's an x-ray of a baby who shows very poor lung inflation with a pneumomediastinum on the right, a very small basilar pneumo on the right, and a pneumothorax on the apex on the left with a chest tube in place. This baby would need a higher mean than on conventional to get the lung recruited and be able to wean oxygen. Well, if you have adequate inflation, it's pretty much similar to what we would do with the small preterm infant. You would use a mean airway pressure equal to or less than conventional and a frequency in the 8 to 10 hertz range. And here's a baby who's got multiple chest tubes, but really has pretty reasonable lung inflation under these circumstances, and therefore doesn't need extra mean airway pressure, and in fact that may just worsen the air leak. Non-homogeneous lung disease is one of the more difficult ones to treat, meconium aspiration being one of those, and the predominant one we have to deal with. We would start with a mean airway pressure equal to conventional. In this disease, we use low frequencies, 6 to a maximum of 8 hertz with the oscillator. With the jet and the flow interrupter, you would use more in the 4 to 6 range. Delta pressure should give you good chest wall movement because you need fairly good peak to trough pressures in the airways to help clear out the meconium. And here's a baby overinflated with atelectatic areas and already had multiple air leaks from severe meconium aspiration. And these patients are very difficult to take care of, but high frequency will frequently be life-saving for them. Some patients with meconium aspiration have a more diffusely hazy lung, and because they may not have aspirated very much meconium, and they have more of a shock lung picture. Again, using lower frequencies because of the risk of air trapping, again, good chest wall movement. This is a baby with that kind of a problem who's got more dense areas in the upper lobes and more lucent areas in the lower lobes. And so this baby would be using a higher mean airway pressure in an effort to get the lung open a bit and still using the same frequency strategy. Pulmonary hypoplasia comes in two forms. If you have uniform, meaning that both lungs are equally affected, and this is seen most commonly in prolonged rupture of membranes, but can also be seen with severe hydrops. You would start with a mean airway pressure equal to conventional. You'd advance 1 centimeter of water about every few minutes until the oxygen sat increases. Again, using higher frequencies to avoid big pressure swings or volume swings in the distal lung that might injure it. And here's a baby with severe hydrops and significant fluid, bilateral pleural effusions, and that baby will have a small lung that needs to be managed gently. This baby, on the other hand, was a preterm infant born to a mother who had ruptured membranes at 15 weeks. And you notice that the lungs are only inflated to about 7 ribs, but they are clear at that point. And so what you know is these are small lungs and you've cleared out the problem, but if you push them too much, you will injure them because they are small and fragile.